Welcome to iCON virtual event. My name is Barbara Ho. I'm a registered nurse. I'm also the Chief Nursing Officer of iCON Chinese Division. I will be the Master of Ceremony today. People who are joining online, how are you? Welcome to iCON's Chinese online forum. The topic is Healthy Living, Healthy Heart. Some friends only participate in the event which are organized by iCON. I give you an overview of iCON. iCON is one of the projects initiated by Digital Emergency Medicine of Faculty of Medicine, UBC, and led by Dr. Kendall Ho, have been established for over 16 years. The main purpose is to help busy multicultural groups, patients, their families, by reliable health information, community resources, and network in respect of chronic disease, education, prevention, and cell management by way of forum, workshops, and web technology. To help patients with awareness, best health practices, to reduce this disease risk and advocate for formal therapies, help them access reliable health network and electronic tools, and helping them more familiar with technology and how to improve the health quality, especially know more about the electronic tools. Welcome to the second day of the forum on healthy living and healthy heart. Yesterday, we give an overview of heart disease, what is atrial fibrillation and its symptoms, and how to mitigate the risk factors. And also look into some electronic tools and online resources, helping people to self-manage. Today, we would like to know the difference between men and women with heart disease, and also to reduce stress in order to minimize cardio event. And we'll also learn how to do some practical self-help and lifestyle management to help you stay active. And I would like to introduce the special speakers. The first one is Sedlak. She's a cardiologist. She is a PhD of medicine of UBC and complete internal medicine and cardiology training. And also she completed specialist training on women's heart health from a university in California, Los Angeles, especially focused on women without any obvious coronary arterial disease, but will have heart discomfort. The next one is Dr. Young Taylorson, a registered psychologist in BC, practice in a clinic in BC, and also he is also a part-time instructor in many universities in BC. And also every month regularly, he co-hosts a program with AM 1470 with Deborah Moore. And lastly, there are two registered physiotherapists in Canada. First one is Nicole Dye. She was born in Australia, but growing up in Vancouver. She completed University of Toronto and also in Hong Kong. And she is now taking advanced training in acupuncture. And the other one is Emily Pack. She completed the Bachelor of Science in Hong Kong and also kinesiology and Master of Health Science. She has been practiced at physiotherapies for over 15 years.
All right, good morning, everyone. And thank you for asking me to join this really exciting seminar. My name is Tara Sedlak, and today I'm going to be talking about women and heart disease. So I wanted to first start off by looking at some of the learning objectives in this 20-minute talk. And so today I wanted to talk about sex and gender differences between men and women with respect to heart health. I also wanted to talk about some of the unique risk factors that we see in women only, and some of the unique signs and symptoms of heart disease or a heart attack in women. And finally, how to manage heart disease and when to seek out help from community resources. So the scope of the problem is large, and there was a misunderstood report that came out by Heart and Stroke now back in 2018, so over 5 years ago. It was really informative, and some of the data from them showed that cardiovascular disease is the major leading cause of death amongst women in Canada. And most women and men don't know this, but women are actually 6 times more likely to die of cardiovascular disease than breast cancer. Also, 60% of heart disease in women presents as a heart attack with no warning signs. And so certainly you want to get on top of your risk factors for a heart attack and, of course, the signs and symptoms of a heart attack early. So heart disease in women is common, we know that, and it's a major leading cause of death in Canada, but only 30% or 37% of young women in Canada believe that heart disease can be different than for women compared to men. Only 28% of women know that heart disease and stroke are the leading cause of women's death worldwide. And finally, only 20%, so 1 in 5 of women's doctors talk to them regularly about their heart health. So what are the risk factors for heart disease? Well, actually, there's 9 risk factors that account for about 90% of the risk for heart disease. And they include high blood pressure, alcohol intake, high cholesterol, inactivity, obesity, poor diet, diabetes, smoking, and psychosocial stress. And what we know is that diabetes, smoking, and psychosocial stress are actually stronger risk factors in women compared to men. For example, if I have a woman in my office who has diabetes, and I compare that to a man who has diabetes, I am much more worried about the woman with diabetes in terms of her heart risk moving forward because she's much more likely to develop heart disease than a man with diabetes. So we know that there are sex-specific risk factors, and these are risk factors that can actually only be found in women. And until we actually started researching women and their heart disease risk factors, we actually didn't really know that these were risk factors at all. One of them is something called polycystic ovarian syndrome. And this is a condition where you can have changes in your metabolism. You can sometimes have changes in your weight. You can have cysts that form on the ovaries. You can have changes in your menstrual cycle. And you can have higher cholesterol and higher fasting sugar. And all of that places you at increased risk of cardiovascular disease many years down the road. We also know that other risk factors during pregnancy are very important. For example, gestational diabetes. So if you develop diabetes only during pregnancy, but never again, that actually puts you at a 2-fold increased risk for future cardiovascular disease. Other complications like high blood pressure during pregnancy, preeclampsia, which is essentially toxemia, where you can get a lot of swelling during pregnancy, more than you would expect, liver dysfunction, neurological changes that can put you at increased risk. And then some actual pregnancy-related complications where you have a premature delivery or stillbirth. We know that that can increase your risk of cardiovascular disease, again, many years down the road. Finally, we know that there are risk factors related to menopause. So certainly after menopause, the risk for cardiovascular disease in a woman sharply increases. And in fact, I have many women in my practice who say, geez, my cholesterol and my blood pressure was always normal or very low, and now suddenly it's gone up and I'm 55. What's happened? Well, they've gone through menopause, and with the changes in menopause, those risk factors have increased, and therefore they're at increased risk for heart disease. And we know that if you have young menopause, so early menopause, sometimes called premature ovarian failure, where you have menopause before the age of 40, you actually have a 95% increased risk of having a future heart attack. Inflammatory risk factors are actually being developed as risk factors as well, and lots of study has gone into this. So conditions such as rheumatoid arthritis, which many of us are familiar with, can lead to joint pain and swelling. Also lupus or systemic lupus, where you can get rashes on the face, inflammation of the hands, impairment of the kidneys and other organs. All of those inflammatory markers increase the risk of heart disease and sometimes double the risk of heart disease. And these are actually much more likely in women. For example, lupus is found 90% in women only 10% in men. Breast cancer is very interesting. So breast cancer survivors now are very common, where women with breast cancer are actually doing very well for the most part. We've had all sorts of advances in terms of medications, chemotherapy, radiation therapy. However, interestingly, now a woman can survive breast cancer, but actually be at increased risk of heart disease because of some of the therapies that she's had. So, for example, certain chemotherapies can put you at risk for something called heart failure, which is where water backs up into the lungs and into the legs. Radiation therapy, which actually overlies the heart, if you have left-sided breast cancer, you can actually get some scarring in the arteries leading down to the heart. And that long-term scarring from radiation can put you at risk for having blockages, and those blockages can put you at risk for heart attack. And finally, mental health. And mental health is extremely important, particularly in women, but also in men. So we know that depression and anxiety can increase a woman's risk for a cardiac event by upwards of 50 to 70%. Those are pretty huge numbers. And that a very stressful event, such as death of a loved one, loss of a job, can actually cause a heart event. And that's called a stress-induced cardiomyopathy, where literally you have a broken heart syndrome, where your heart actually fails to function well. You can actually be at risk for heart failure. And that can all happen because of a very stressful event. And this happens 90% of the time in women. So there is a specific interaction between those types of events and hormones and female sex. So let's move on now. We've certainly reviewed some of the risk factors. We know that there are sex-specific risk factors related to pregnancy, menstrual abnormalities, and also related to menopause. We know that inflammatory risk factors, breast cancer, and also mental health are very important. What about the symptoms of a heart attack? Could that be different between men and women? And I love this quote. This is from Carolyn Thomas. She does a lot of work on the internet and social media. She's a heart attack survivor. And she said, in my mind, the stereotypical heart attack was an old guy clutching his chest on a golf course. Women need to know that they can have a heart attack, yet still continue to walk, talk, and work. And that was her experience. And she talks all about it in some of her books and in some of her online work. Suffice it to say that learning the signs of a heart attack is obviously very important. And that in women, still the number one symptom that you can experience is chest pain when you're having a heart attack. So it's still very important to look at chest pain as being a major symptom. However, we know that women, number one, can experience their chest pain differently. So men classically would describe it as the elephant on the chest or a lot of pressure on the chest. Women actually describe their symptoms differently. So they can describe it as a tightness or as a squeezing. And sometimes that can be misinterpreted by themselves or even by practitioners saying, oh, geez, this doesn't really even sound like a heart attack, when in fact it still is pain in the chest. Women can also have lots of other symptoms. So they can have just jaw pain or arm pain or pain radiating from the chest up into the neck or through to the back. And that can be really confusing because some women have said to me, geez, I thought it was just a bad toothache, when in fact they were having a heart attack. And then finally, women can get other symptoms associated with their heart attack. So not only can they get pain, but they can get shortness of breath, they can get sweating, they can feel really lightheaded or nauseous, along with some of the other symptoms that I've described. And so at the end of the day, if you're experiencing something really serious, a real change in symptoms, and you're having a lot of these signs and symptoms, don't delay and seek help. We know that in addition to differences in signs and symptoms, there can be differences in the causes of a heart attack in women. So I think most people think, geez, well, a heart attack must be caused by a blockage. And still, that is the most common cause. And the blockage typically, there's cholesterol in the artery, there's a clot that forms, and then you get this big 100% blockage, and there's no flow down the artery. And so that causes some death of heart muscle. And that's sort of a classic heart attack. We know in men that causes over 97% of heart attacks. So we know that when we do a specialized test called an angiogram, where we feed a catheter up, a little tube up to the heart, put dye into the arteries, we're going to see that blockage, and hopefully we'll be able to fix that with a balloon and a stent, or sometimes bypass surgery. However, only in 85% of women is a heart attack caused by that kind of blockage. So 10 to 15% of the time in women, if we're doing that angiogram and looking for a blockage, we won't find it. And sometimes we won't know the cause for the heart attack. So we now know, in the last 10 years, we've done a lot of research on this. We now know that some of those heart attacks are caused not by blockages in the arteries, but by some other things that can occur inside the arteries. So for example, you can get an actual little tear inside the artery where the lining of the artery can tear, and that's called a dissection. And that little tear in the artery can be so small that you can put dye into the arteries. And if you're not really looking for that tear, you can actually miss it. And that can cause a heart attack. We also know that spasm of the arteries, so where the artery starts off completely normal and then it spasms down really tight, and then opens back up again. That's called coronary vasospasm. And that can cause a heart attack. But unfortunately, if you do the angiogram, put dye in, and it looks normal, maybe it's because you didn't catch it right when it was spasming at the time of the event. And finally, we know that in women, they can actually have plaque inside the arteries or some sort of clot causing the problem, but sometimes it's further down in the arteries. We may not necessarily see it right in the large blood vessel, or sometimes it may have resolved by the time that you get the angiogram done. And so we may not necessarily be able to see it on the angiogram, and we'll just say, geez, everything looks pretty good, when in fact they did have a blockage, but it had resolved. We know that women are more prone to small blood vessel disease. And what I mean by that is we have the large blood vessels surrounding the heart, which is what we were just talking about in terms of blockages, tears in the arteries, spasm of the arteries. But actually there's the tiny micro blood vessels that funnel right down into the smaller parts of the heart. And those are called micro blood vessels. And those can actually become dysfunctional, and they can become blocked, they can become tight. The lining of those blood vessels can become abnormal, and that can cause sometimes a heart attack, but more commonly, it can actually cause severe chest pain. And this is way more common in women. So again, 80 to 90% of microvascular disease is found in women. And there are some reasons for that. We have smaller size vessels, we have more stiffness in the small blood vessels. But suffice it to say, it's more common in women, and it's difficult to diagnose. And so now we are able to diagnose this small vessel disease at Vancouver General Hospital. We're one of the only places in Canada that can diagnose this disease. And what we have developed and what we brought to VGH is a specialized type of machine. And this machine can actually, during an angiogram, where you put dye into the large blood vessels, test them, you note that they're normal, you can actually put a catheter down into the small blood vessels and actually test their function, where you can actually now see that there will be small blood vessel disease and abnormal function of the small blood vessels. And we can actually give some of these women who've had chest pain for years and been told that there was nothing wrong, we can actually now finally give them a diagnosis. So finally, in the last 5 minutes, I want to talk about how to prevent and manage heart disease. So first of all, prevention is obviously very important. So we always say to people, you should exercise, but really at the end of the day, you should exercise frequently. You should try to exercise such that you get your heart rate up to a certain heart rate, and your practitioner can help you sort of develop what heart rate that would be. And you should try to do that for at least 30 minutes, 5 times a week. We also know that there's healthy diets, and that a Mediterranean diet in particular can be really helpful for preventing heart disease. And with a Mediterranean diet, high in fruits and vegetables, chicken without the skin, fish, low in red meat, low in eggs, can be really helpful. Stress management. I think I've mentioned particularly in women that stress can be a risk factor for heart disease. It can be a risk factor for that broken heart syndrome that we were talking about. And so really getting on top of stress management, counseling, doing various things like yoga that might be helpful, whatever it is in your life that you feel would be helpful for stress management. Smoking. We know that smoking is actually a greater risk factor in women compared to men. And so, obviously stopping smoking would make a big difference. And if you stop smoking for long enough, sometimes your risk goes way down, even to the level where it's like you never smoked. So certainly trying to stop smoking. Minimizing alcohol intake, a few glasses a week, I think is reasonable, but obviously a lot of alcohol can cause various syndromes in the heart. And then finally, maintaining a healthy weight. So in terms of what you can do with your practitioner, or even what you can do on your own, is you can check your risk factors and get your risk factors checked. So you can check your blood pressure regularly. And you can do that at home, you can do that in a pharmacy, you can do that with your family practitioner, just to make sure that you know your numbers and you know whether or not they're abnormal or normal. And if they're high, getting them treated early. You can have regular blood tests done. And with those blood tests, you can have your cholesterol checked, you can have your fasting blood sugar checked, and you can see whether or not you may have some evidence of diabetes, again, which we've said is a very important risk factor. Just having regular visits with your family doctor and or your specialist. If you actually have underlying heart disease, seeing your specialist regularly. If you don't have heart disease, getting regular visits to your family doctor to get some of these risk factors checked up on is important. Cardiac rehabilitation program. So many people, after they've had an event, both men and women, heart attack, bypass surgery, they will attend what's called cardiac rehab. And this is actually available at many different hospitals. Even smaller hospitals have this resource. And there's essentially a dietary program, an exercise program, and it's supervised. And so a lot of people, it helps them get back into an exercise program after they've had an event. And then finally, seek trusted resources and training online or through your different practitioners on how to live with heart disease, which is obviously very important. So finally, when should you seek help? And this is not always clear to people, but certainly if you've checked your blood pressure, you've looked up your cholesterol online, you've looked up your sugar online, and you can see that it's not within where it should be, and it's uncontrolled, then I think you should seek help from your practitioners. Certainly, if you have a strong family history of heart disease, but you don't have any of those other traditional risk factors, but you have lots of family members where they have had a heart attack or a stroke, particularly at a younger age, I think, it would be helpful to go to your practitioner and ask to be screened at a younger age because you have this premature heart disease in your family. And finally, if you have worrisome symptoms, so some of those symptoms that we described before, particularly in women, chest pain and shortness of breath and lots of other associated symptoms, if something at the back of your mind is just saying, this is not right, this is new for me, I'm concerned about this, then I think you should absolutely go out and seek help. So in terms of resources, we have the Heart and Stroke report called Misunderstood from 2018, and it's still very relevant now 5 years later. So I would really recommend that you have a read through of that. We also have the Canadian Women's Heart Health Alliance, and this is an alliance that we built over 5 years ago. It's made up of women with lived experience, so patients who have had heart events or who are at risk of heart events, allied healthcare, so nurses, dietitians, other practitioners, and then of course physicians, cardiologists, family practitioners, and it's across Canada. And we've actually made up some online tools and resources, and there are some very interesting infographics on different types of heart disease and different risk factors for heart disease that you can certainly have a look at, and those are available in many different languages. Finally, there are some community resources to link HealthLink BC. 811, of course, is your health system navigators 24 hours a day, and Chinese speakers are available. And also there's a UVic self-management program. And again, Chinese speakers are available. So have a look at some of those great community resources. So they're just showing you again the community resources, the Canadian Women's Heart Health Centre and the Alliance, where there are a lot of resources on there. And then, of course, the Heart and Stroke Canada. So with that, I would like to end off and thank you again for allowing me to participate, and have a great day.
Yeah, I can start my video. Okay, 好多謝
Thank you, Dr. Sedlak, for your very detailed and very special presentation on women and heart disease. And she's already taken us to some of the community resources, and one of them is the Canadian Women's Heart Health Center. But this is this Canadian Women's Heart Center is from University of Ottawa's Health Institute. They founded that health center to help the public to understand more about women and heart disease. They have done a lot of research, and they hope that through these articles and their website, they can enhance our care and improve the prevention of coronary artery disease in women. So they have ongoing studies and research, and they publicize and educate the public about women and heart disease. So you can browse their website and learn about the details. For the time being, it's only available in English, but I have a little bit of time to share with you my own experience. Just now, Dr. Sedlak mentioned that a small blood vessels disease, I have been diagnosed of that. At first, I didn't realize that, but I heard people often say that if you do activity, if you feel that your heart, there's angina in your heart, then you should pay attention. So when it first started, because I went grocery shopping, I took the groceries from my garage to back to my home. But with such a short distance, I already felt discomfort in my heart and neck. So I went to see a doctor. The doctor first gave me a stress test. So I was put on a treadmill and see what if I went too fast, if there were any problems with my heart. So I had to do it 3 times. I failed all 3 times. So it was confirmed that my blood vessels and that supply to the heart was not enough. So that's why I had this angina, and my feeling was in before it radiated from the chest, then it went up to the neck, even to the jaws, just like Dr. Sedlak as the same thing. So I was curious. So in the end, the doctor dilated, made the scan of my. I didn't have the 3 eyes. Any of the 3 eyes, everything was normal. All the indices were normal. How come I had angina? So after I saw the doctor, I was told that I have this small microvascular disease. Yes, so I had to be put on medications, and the doctor explained to me, look, even you don't have any of the 3 highs, still you have to maintain a stable beating of your heart. Don't let it go too fast. So the doctor prescribed some medication to lower my blood pressure as well as lower my cholesterol. Of course, doing exercises, I had to find time to do that to have good time management so that I could maintain a regular heartbeat. So this is my experience that I wanted to share with you. And now,
the Q&A section. I would like to bring back Dr. Yang and also 2 physiotherapists.
Hi, how are you guys? Thanks for staying and answering our questions. So people in the audience, if you still have questions, you can still write them in. I'm sorry that the cardiologists and other medical practitioners are not here to answer questions. But if you have questions for them, we hope that come January we'll have another session where we can answer all the questions that you have submitted. For the time being, we have just a few questions for you guys. I want to ask Dr. Young, you were talking about reducing stress. So what are the ways to reduce stress? Really, I mean, usually if you're too busy at work, you don't have time for any doing any fun things. So people say that, well, you can do things to reduce stress. I don't have time for that. I have very busy work schedules. What can we do? What ways that you can recommend us to reduce stress? Well, it's a very good question because I have that problem myself. Well, let's put it this way. Well, I'll tell you some good news. It's not like I have to sit down still for 1 hour or go to the gym to run and all that. Very simple. Even 3 minutes and 5 minutes you can start that. That's already enough. It's a good start. And if you can keep that up, just take a little bit of time every day, 3 to 5 minutes, like Emily was saying. Those exercises, you do a little bit of that, start with 5 minutes and build up, and then make it a routine, and then you can build it up gradually. That's the optimal way. So there are many, many tools. For example, singing, dancing, drawing, writing poetry, writing essays, or simple enough, just go out and walk in the park, take a walk in the park. So that's one way to reduce the stress, Gesundheit. And then so you can just sit still. You don't have to do this and do that. You can still do these things. So that is a very good recommendation. So whatever, wherever you are, or wherever you live, or what kind of environment you live in, you still can take advantage of your environment to reduce your stress, to relax, to chill out, singing or dancing. Well, those are fun things, right? So yeah, well, I think you guys can learn how to sing and just buy a karaoke machine. You can think about that. I mean, if you don't have 5 minutes a day, well, there's still another way. Sleep. Yes. I think a lot of people agree with that, So just drop everything and don't think about it. Just go to bed, sleep. Yeah, you're right. So if you cannot even take 5 minutes or any time to do anything, at least, you can look at our sleep. Are there any ways to improve our sleep? So if you can improve it, that's already a progress. So talking about sleep, many people, when I'm asleep, I fall asleep for 1 hour, then I can't sleep at night. So what happens? Well then, what you need to do is before you sleep, before you go to bed, so you set your alarm clock, okay? And then when it comes time, so it wakes you up. So, but don't take a nap very late in the afternoon, for example, before 1 or 2 p.m. you take a nap, and not to take a nap for longer than 20 or 30 minutes. That's the general recommendation. Of course, it all depends each person's health status. So, okay, if you want to make up for your sleep, fine. But I see some people who sleep for, like Barbara said, 5 hours. That's too much, man. Right, you're right. Yeah, that's a very good recommendation. Thank you, Dr. Young. And now, Em and Nicole, we have a question for you guys. This is a difficult one, maybe not for you, but an attendee says he wants to know, or she wants to know that he has to improve his or her lifestyle to do exercises, but this person wants extreme or sedentary like couch potato, right? So to start, how to motivate this person? Yeah, people like a couch potato. Well then, like Dr. Young says, to start with, when you start, don't ask too much for yourself. 3 to 5 minutes is a good start already. So if you don't even start with 3 or 5 minutes, no, you can't make it. So have a good start and then be persistent, okay? And then you said like in the morning, after you wake up, after you brush your teeth, after you have breakfast, you give yourself 3 to 5 minutes to do some exercises. That's not too difficult, right? So when you start developing that habit, do it every day, then you develop a good routine. So after you've started this routine, then you will notice some physiological changes. A lot of people notice that, I have more energy, I can sleep better. So because after you're doing exercise, you've exerted. So at night you feel more tired, you sleep better, and you have more energy, and you want to do more exercise. It's a good cycle, not a vicious cycle, a good cycle. Actually, I think it's you can addictive. It could be addictive. For sure you have to know your health status. Maybe medical professionals will tell you, well, you have to do just simple exercises to start to reduce weight, or maybe you have some chronic diseases developing, so you have to increase your activity level and as well as the time to do activity. So you have to be determined, okay? And although sometimes you say that, well, doing exercises, it doesn't mean you have to run or you have to swim or you do strenuous exercises. I think some people will just, they've never done any exercises, but even a little bit of house chores, house activity, that's good enough. That's a good start already. So if you're so lazy, a lazy bone, but you still have to do it, right? Even vacuuming or dusting or mopping the floor, that's already some kind of activity. It's better than sitting there all day watching TV or whatever. So then you increase your time, increase your intensity a little bit. So it will help. Another recommendation is that, of course, different folks, different strokes. So, but some people like to do it at home. Some people like to be accompanied, or somebody lead them to it, or somebody to push them. That's better for them. Actually, there are many resources in the community. For example, in Vancouver, there are many community centers. For example, exercise classes. They're cheap and they're fun. So you can think about going out and join other friends and your buddies, and have an instructor lead you. Do it every week. It's not only good for your body, it's also good socially. Right. That's a very, very good recommendation. It doesn't matter which area you live in. There is always a community center which offers these facilities, and there are also classes for those who can join if you are interested in those. So that's a very good recommendation. Thank you. And then there's an attendee who wrote a question. Rubber band stretching exercises. Can you do it every day? Using elastic bands, is it good to do it every day? Yes, of course. Because elastic bands, there are different challenging levels. So I'm using different colors. So red is the easiest. So use do simple movements and then build up to more intense movements. That's no problem. When you do it, say after you've warmed up, or do you do it after you've warmed up, or how do you start? I've never done elastic bands. Well, if you, of course, it's best to have warm up first. So we call it a kind of resistance. So we have one here. So it's it's for resistance, meaning you have to exert, you have to use some strength to pull it, and if you do not warm it enough, then you're likely to get hurt when you pull. Actually, it's kind of dangerous if you do not control it well. So remember, when you do elastic bands, use slow movements, don't jerk. don't go too fast. If you go too fast, and then you may sprain your muscles. Actually, elastic bands has resistance. It helps train your muscles. There are many ways you can do it. You can hold it for 5 seconds and then slowly bring it back, and so you strengthen your arm muscles, or you can put it on top of your head and all. There's so many ways to do it. That's very good. Next question for Dr. Young is about depression. Okay, depression. I think this person maybe has someone who suffers from depression. How can you help this person? How can you start helping this person? Okay, well, that's a good question, but it's a very major issue. Well, we can look at it from different perspectives. First, how the mood, where's the source? What's the source of the, is it hereditary, or is it a long-term thing? Or so we have to find out in order to treat it properly. So generally speaking, there are many things that we can do. For example, if you want a quick fix, of course, then there's medications, and if it's hereditary or if it's genetic, well, maybe you can use some medications to help you. And then some maybe due to environment, those are temporary issues, so you can use some psychological treatment. So the general recommendation is to use both, okay? So that's the best thing. In that way, you can improve your condition. So after we've learned all these strategies, we hope that we can find some resources to support us, our family, our friends, and everyone. So whatever it is, depression or anxiety, some are chronic, right? So what you need is long-term support to build up this support network. Chances of success would be higher. Yeah, so there are many ways that you can try, right? Thank you, Dr. Young. Now, one attendee has a question. Are there videos that instruct us self-balance? Well, just balance. I think you two ladies may have some suggestions. Balance when you do exercises, especially seniors. That is very important. But just now you have demonstrated and talked about the importance of holding on to something for support. Of course, they're wheelless. They don't have wheels, right? So if you hold on to something that is mobile, then once you lose balance, you can fall, slip and fall. So that is very important to remember. Don't slip and fall. So the most important thing is to find some support. If you cannot do it standing, then do it sitting. Right. Actually, balance, it doesn't mean that you have to stand to get balance. When you talk about balance, it's not just the muscle strength, it's also the endurance. It's also a coordination of all different parts of the body. Simply put, when you do exercises, you can do it sitting down or standing. You can still train your balance. So on YouTube, there are many clips that you can look at. You can practice some yoga for seniors, or Tai Chi. Those are balance exercises, because the movements in Tai Chi, some of them, the golden chicken with standing on one leg, that also trains your balance. So on YouTube, this is an excellent medium. So you can find yoga, sitting down yoga, or seniors Tai Chi. Just so I am a yoga instructor, so I also teach yoga and mixture of yoga and Tai Chi. So you can try many things. So now there's so many resources. You can practice at home, or you can find professionals to teach you. And also, when you do exercises, the speed is also important. Don't try to go too fast, or don't try to rush it. Thank you. Don't do a rush job, okay? Because it's not good for you, okay? So you have to pay attention to the rate of speed as well as your postures. So if you are doing something that you have to stand straight or sit up straight, don't lean and don't tilt. So don't lean forward or don't lean backward. So the posture is also very important. Yeah, for balance exercises, even it can prevent elders from slipping and falling. So there are many resources that you can find to help you learn about doing balance exercises. Well, because of time limits, that's all the time we have for answering questions. So thank you, Nico and Emily, for answering those questions for us. So if anyone who missed the presentations of today, well, later on you can just click on our recordings on our iCON website, and if you have not joined our email list, you can see on the screen here. And be part of our email list. So you can scan the QR code to join the iCON mailing list. And then in future, when we have activities, events, we will contact you. We'll let you know directly. We thank you to our speakers of today, Dr. Sedlak, Dr. Young, Emily, and Nicole, to share with us such information, and I hope that it can help everybody. And I also want to thank our funder, Patients as Partners Initiative. And we want to thank our community partners. There, you can see 15 of them on the screen, or actually 14 of 13. And also we want to thank our media partners, 8 of them here, to publicize and let the public know our work. And we also want to thank the partners at Viewing Hubs. Today we have 2. Yesterday we had 4. For example, CRC Health Center, South Vancouver Neighborhood House, Success, and the day program for elders, as well as Villa Cathay. We thank you to our interpreters. I'm not going to name them all today. And we also want to thank, yes, again, our interpreters, and Shani, Wenhui, and Cliff. We thank LNB, the interpretation services, for doing our interpretation. Yes, this is our iCON website. If you have any questions or if you want to contact us, write us emails to our email address. And as we age, there are more risks of having chronic diseases. So these problems may make your body weaker and impact your quality of life. So if you have good lifestyle habits, and if you're persistent and make effort, you can still have good health. I hope that over the last 2 days, our presentations have been helpful to you, and that you will keep making good effort and just join us the next time we have our events. For the time being, thank you very much. Bye.